Good evening, everyone, and welcome to the next in the monthly series of webinars being offered by the Columbia Mailman School of Public Health, its global consortium on climate and health education, Earth Medic, Earth Nurse, and the University of the West Indies. It's my pleasure this afternoon to be your moderator for this session, which will be looking at how to prepare a policy brief. I am Nicole Foster. I am law lecturer and founding head of the Law and Health Research Unit in the Faculty of Law, University of the West Indies, Cave Hill campus. So let's just jump straight into it. The purpose of the webinar, today's webinar, is to equip health professionals with the necessary skills and techniques to be able to deal with issues relating to climate action in different settings. We have some stated objectives for the session, which is to understand the critical role of policy briefs in influencing climate and health-related legal and policy decisions, with a focus on adaptation, mitigation, and broader determinants such as water, food, and transport to achieve co-beneficial outcomes for health and the environment. And our second objective this evening is to identify essential components to create compelling policy briefs, including essential writing components, understanding the context in which briefs are needed, and identifying appropriate stakeholders for submission. And for today's session, as is normally the case, there is continuing medical education credits available. Those are 1 credit for the session. It is for CARICOM participants only, may apply, and there will be a link that is shared at the end of the session in the chat with a survey, and it is with that you would be able to process your CME credit. Then note that the link will only be live for 24 hours after the close of the session. Now, at this point, we have a quick poll question that we want to ask, so we have a basis on which to see how successful we are by the time of the evening. Okay, so we have 100, so I think I can click on end poll. Oh no, it's changing on me. So, okay, I think we're good now. It is, I think I can say right. So we can share, okay, the results are being shared. So we have actually the majority of persons on today's call are not familiar with haven't had to write a policy brief before. So we're really quite happy that you're with us today, and we hope that come the end of today's session, we can definitely see that there's some increase in certainly how you feel, your level of comfort in terms of your ability to create a policy brief. So let me move from there swiftly on to our presenters today, who are really well qualified to help us navigate the space of policy briefs. First, we have Zachary Phillips. Zachary is an Antigua and Barbuda attorney at law. He is currently Crown Counsel in the Attorney General's Chambers in Antigua and Barbuda. He hails from, in terms of his academic background, from the University of the West Indies, Cave Hill. And I have to mention here one of my former students. I'm so proud to be on the panel with him. So he has a BSc in political science and law and an LLB, first class honors, both from the University of the West Indies. He also has an LL.M in public international, specializing in public international law from Queen Mary University of London, which he gained with distinction. And And his main areas of interest are international law and regional integration law. And he has had several publications in journals such as the International Community Law Review and the Review of European Comparative and International Environmental Law. Zachary is going to start us off this evening, and his presentation is going to be an introduction to effective policy briefs. So setting the scene, so to speak, giving you the broad brush. Then we will move from Zachary on to Lawrence Jaisingh. He is Director of Health Policy Research and Planning, Ministry of Health, Trinidad and Tobago. And he has 20 years experience working in the health sector. He has a BSc and MSc in economics, a master's in supply chain and logistics, master's in telecoms, regulation and policy, a master's of science in health management, and an LL.B degree. So very well qualified to speak to these issues. And in his role within the Ministry of Health in Trinidad and Tobago, he has been responsible, for example, for the development of the ministry, the Trinidad and Tobago's breastfeeding policy, the sexual and reproductive health policy, the mental health policy, and many others. Dr. Jaisingh's presentation this evening will be on making a successful evidence-based policy brief, a government perspective. And lastly, we have Dr. Nicole Dawkins-Wright, hailing from Jamaica. She is a committed healthcare specialist and public health practitioner who is driven to contribute to nation building through the direction of programmed activities that increase the resiliency of the health system to optimize health care delivery for health protection and medical treatment in emergency and disaster situations. She is currently the Senior Director for the Emergency Disaster Management and Special Services Program, National Health Disaster Coordinator, and Director for the Health Emergency Operations Center, Consultant Emergency Physician with the Ministry of Health and Wellness in Jamaica, Climate Change Focal Point, a Resilient Smart Program Focal Point, and Emergency Medical Teams Focal Point within the Ministry of Health and Wellness in Jamaica. Dr. Dawkins-Wright has a bachelor's in medicine and surgery, a doctorate of medicine. She has a master's in public health, disaster management. She is also a Caribbean climate change and health fellow. She also is a certified instructor and coordinator and an associate lecturer for resuscitation training, mass casualty management systems, and health aspects of disaster management in Jamaica. And with those very varied hats that she's worn, she's made several presentations in various areas, including climate change and health at the Sir Arthur Lewis Institute of Social and Economic Studies in December 2024, and policy considerations in the management of NCDs like diabetes in the face of climate change in the annual International Diabetes Conference in April 2024. So you see there we have a full agenda. How we're going to run things, each panelist will have roughly 15 to 20 minutes to make their presentation. We would ask that any questions that you have, you post in the question and answer section, not in the chat, in the question and answer section. We have someone who will be collecting those questions. And then once everyone has spoken, we would then have an opportunity to engage with your questions. So without further ado, I will hand over the mic, so to speak, to Zachary to make his presentation. Zachary, the floor is yours.
All right, thank you very much. And good afternoon to everyone who is, well, good afternoon, good morning, good evening. I see that we are joined from around the world. So great to have you all here. And I am looking forward to being able to help those persons. I believe it was the 78% of people who said that they have never done a policy brief before. I hope that by the end of this, you feel confident enough to recommend whatever recommendations that you think are necessary within the field of climate and health. So let's start our discussion today. My name is Zachary Phillips. As stated before, I'm a Crown Counsel in Antigua and Barbuda, and I work mostly in the area of the Attorney General's chambers. So I do a lot of litigation as well as recommendations for amendments, but I'm also a negotiator on behalf of my country within the climate field. So this is why I've been asked to come here to discuss my experience as it relates to policy briefs. So our first segment is going to be called What is a Policy Brief? And I know it sounds very generic, but as we said in the poll, 78% of persons have not experienced or have had their own interactions with writing a policy brief. So in describing it, as this is an intro and I only have 15 minutes, I'm breaking it down into what, why, and who. So, what is a policy brief? A policy brief can, in its most simplest form, be described as a succinct document that is a tool to share policy recommendations to a specified audience. It clearly connects policy concerns to specific recommendations or initiatives. And I've highlighted four keywords that you're going to hear a lot throughout the presentation, and I'm sure throughout everyone else's presentation as well. Those are succinct policy recommendations, specified audience, and connects. And you will see why I highlighted them as we continue speaking. Now, the second thing I want to bring to everyone's attention is why. Why do people make policy briefs? Policy briefs can serve different purposes. So one of those purposes is to provide advice to the relevant stakeholders. Another purpose is to communicate an issue to the relevant stakeholders. Or thirdly, to assist persons with making difficult or complex decisions. Now, with this first slide, I hope that some of you who said no in the initial poll would realize that maybe you have been engaging in policy briefs, you just never had the title policy brief at the top of your paper. But if we're using the term in a traditional sense, policy briefs usually have a certain structure and format. But seeing as this is a changing world, the pandemic was something that no one expected, but we all lived through and came out on the other side. I want us to think a little bit wider of what we consider a policy brief, and perhaps you've done it already, or perhaps it's something that's more manageable to you when we continue to discuss it. So next slide. I was asking if anyone has made a policy brief. Well, we have that answer. And the final part of the introductory section, I'll call it that, is who. Now, to my mind, when dealing with policy briefs, who is the most important question that you must ask? Who is your audience? Who are you presenting to? Who is the intended recipient of whatever these outcomes, policy recommendations, who is it going to affect? Now, I have a whole section dedicated to this as well, but just for now, let's think about when you are trying to build your policy brief or prepare your policy brief, outlining the structure, it's very important to remember who is the intended audience because it would affect how your policy brief is structured, how you deliver it. It might even affect the way in which you present the outcomes. All right. So next slide, the structure of a policy brief. Now, on the screen, forgive me, on the screen here, as I said, there are many ways that policy briefs can be formatted or outlined, but I've used this traditional format just for the purposes of going through an introductory presentation. So the title is quite straightforward. Executive summary, we will discuss further. Background/rationale, it may have different names depending on what area or field that you're in. This may be called the problem statement. This may be called the issue for some persons. Policy options, that would be the different recommendations that you are making and an analysis or data to support why you are making those suggestions. And then your conclusion or recommendations, depending on who your audience is or what your specific goal is. Now, I skipped the title for the slides, but I should make note that when you're deciding what it is that you want to speak to in your policy brief, I want to challenge you or challenge all of us that perhaps The title, in the generic sense or the traditional sense of what a policy brief is usually recommendations on climate and health 2025 or recommendations to the Ministry of Planning, for example. You may want to spice it up or have some sort of creativity, even starting with your title, especially if your policy briefs are going to be more towards an audience that is on a community level. So as I said in the beginning, knowing your audience is very important. And if your policy briefs are geared towards a local community or a parish council, it may be useful to you to have a title that more speaks to the people that you are presenting to. So with that in mind, the second part of any policy brief would be an executive summary. And this, to my mind, is one of the most important parts of your policy brief, no matter what format that you take. So executive summary should be 1 to 2 paragraphs that get straight to the point. You can think about it as an elevator pitch for your overall document. If you were condensing those 2 to 3 pages of your policy brief and had to say everything within 30 seconds to a minute, this would be what your executive summary looks like. Now, you should include in your executive summary the main issue or the problem, why the current system surrounding that issue or problem is not working, and the solution or the main solution or solutions that you are suggesting would be most effective. Now, again, this is supposed to be very succinct. It is supposed to be something that can be said within a minute or so. At most, I would say 1 to 2 paragraphs. So you cannot go into that much details. But if you think of it as a condensation of your overall policy brief, then it's fine if you don't have all the details because you will expand each of those pieces in the different sections of the policy brief that follows. And one further point to note, especially if you're making policy briefs for policy makers, such as government officials or head of departments, usually the executive summary is the only part that they read, or I say with more positive spin, it's the first part that they read. And when it is very engaging and very informative, then they will read the rest of your policy brief. So the next section is called the background or rationale. Again, this may be the problem statements for depending on which area that you work in. But essentially, this is just you explaining the issue that you wish to address. And in this section, you identify why it is a problem and why should your audience care about the solution. Now, with that point, again, I go back to the point of know your audience. So you can already start tailoring your policy briefs as early as your problem statements because you can identify what are the things that government officials may be thinking about as it relates to a particular issue. For example, I I make a lot of policy brief for government officials, and usually one of the first things that comes up is funding and finance. So if you highlight a problem, or when I highlight a problem, I usually always include what is the cost to the government, both directly and indirectly, as early as in this section, so that it is clear why we are bringing it for them to discuss and make a decision. Now, my suggestion is that I wouldn't refer to too much data or findings that you have already done in your background, rationale, or problem statement. And I would say if you are referring to data, I would refer to data that is the most staggering statistics that are available so that it makes very clear to whoever is reading it that the reason that we have created this policy brief is because of this large problem, this very apparent problem, this problem that is affecting 50% of the population, for example, if your policy brief is in something that you can quantify in that way. Again, depending on your audience, tailor your reasons and tailor what their interest would be as to why they would want to read your policy brief. And I know it sounds a bit circular. We created the policy brief so that you could make a decision that would affect everyone. But a very important point to remember whenever you're doing any work in this field is that policy briefs have to be read to be effective. So even though the policy brief is on the table, If whoever is your intended audience do not read it and do not digest the information, then your policy brief will do nothing more than sit on the table. So while you are crafting it, while you are drafting it, make sure that it's engaging in some way. So the next section would be the section, and I've called it policy options. But again, depending on your structure, depending on your field, it may have many different names. But essentially in this section, you are highlighting the research that you have done and the solutions that you have done based on research or based on evidence that you think would be most effective in solving the problem that you just highlighted. So in two broad strokes, you can either categorize or structure these sections by leading with research or leading with outcomes. Now, leading with research is essentially that, identifying what research you have done in the area, what data you have collected, what background information has been done. And again, always be succinct. So try not to outline every survey or every interview that you have done, but, summarize. And that's leading with the research. That would be the beginning of this section, and then you would flow logically into the solutions that your research has led you to. Now, this type of presentation may be more helpful if you are presenting to community groups or if you're presenting to advocacy groups or civil society groups, because this highlights why the problem is so important and why these individuals, your target audience, should, one, pay attention to what the issue is, and two, have an idea or an inclination of what they think the solution should be. Now, on the other side, you can lead with outcomes. So rather than identifying what was the process of acquiring the data, what was the process of your research, you start with each policy option. So instead of saying, I went through and did the research to find out, actually, let me use my background. Legal policy briefs are a lot more based on outcome, because usually the question that I am asked whenever I do a policy brief is, should we go to courts? Should we settle? Should we change the law? Usually those are, in essence, the three policy options that I would have in any of my policy briefs. So for example, if I am leading with outcomes, my first suggestion would be litigation would be our best option, because in the last however many years, there have only been 3 cases against the government. None of them have been successful. And the one that was, or if one was successful, at most the damages that were offered were around 100,000. It is not that much money, but I have used the evidence, the data, the information to support an outcome that I have highlighted. The next outcome or the next option of the policies would be changing the law. I think the law should be changed because in the last X amount of years, we've had several cases that the government has lost, and overall, an accumulated figure is about, I don't know, 500,000 US dollars that we have paid because this law does not support the right policy outcomes, or this law is not the best way forward, etc., etc. So in the second option, leading with outcomes or leading with your policy options is a way to make your policy brief more succinct, and it also connects the research to an action item, which is usually very useful when you are presenting towards policymakers, because policymakers are more concerned about what is the action outcome as opposed to how did you get to the action outcome. And the last section would be your conclusions/recommendations. Again, depending on how you structure your policy brief, you may end with a synopsis of what you've already explained in severe detail in your policy options section, or you may think it's necessary to suggest out of the different options, which option is the best one and the one that you think should go forward. Now, in my experience, presenting to government officials, usually it is recommended that you do not conclude for the policymaker, but I'm sure that this would be based on your different ministers who are involved, or the relationship that you have with whoever you are presenting to. However, a trick that I always use is that when I am asked to write a policy brief, I normally leave the conclusion as general. Options are open to whoever is reading the policy brief. But if I am presenting, I always note in my oral presentation which option I think is the best option. Usually there have been times where after I present orally, I am asked to reduce it to writing why I think it's the best option. But in some instances, I am left to just take instructions from my superiors and act accordingly. Now, it's up to you again, based on your audience. You can decide which one works best for you, but these are my helpful tips as to how it works in my field, at least. Now, the last segment of my presentation, I just want to take a few minutes to indicate a few helpful tips. Know your audience. I have said a lot on that already, but I'm also going to re-emphasize because of how important it is. Then we'll talk about how you can make your policy briefs engaging, and then we'll speak about involving the community, which is very, very, very important. Now, effective preps on knowing your audience. As I said before, it's very important to tailor your policy briefs to the specific audience that you are presenting to. Now, what does that mean? You need to understand the needs of who you are presenting to. The needs of a politician or a local council is going to be vastly different to the needs of a community group or an indigenous group of persons who may need assistance on how they can react to adverse effects of climate change, for example. Now, how you adapt your policy brief to your audience is also quite important. And as a rule of thumb, you should never have the same policy brief verbatim to different audience. If it is that you are presenting to a government official and you are presenting the same set of policy recommendations to the local governance counselor, try your best to do the research to see what would persuade either group of audiences and make the adjustments where necessary. Another suggestion is identify key actors within your audience that you know would be the most helpful with convincing the wider group. And building rapport with your audience is also very useful and a very easy way to help get people to be on your side when you're presenting your policy brief. The next suggestions I have here are making it engaging. Now, even though I know many of you would have dedicated many years to different topics and different issues, unfortunately, at max, a policy brief should be 3, maybe 4 pages. And if you have 4 pages, please make sure that there are charts and pictures involved so it is not 4 pages of just words. That would be my suggestion. I would also say to limit industry-specific jargon. So a great example is the UNFCCC, the climate change regime. They use acronyms more than they use regular words. But if you are trying to communicate what these acronyms mean to the average man in society, then you need to be able to break it down and speak in the language too, so that the recipient of the information will understand. And where you have the opportunity to present orally, use human examples. Use examples of persons that are affected by these decisions or will be affected by these decisions if they are made. So that your policy brief is more than just a document that's sitting on a paper. It's actually a guide as to how the neighborhood family down the road will be able to afford healthcare for the next 5 years, or how the community of fishing folk who are no longer able to fish will be able to redirect and change the way that they live going forward as a result of climate change. It may also be helpful to assess what are the biggest critiques for the different policy options that you have put forward and address them as well, whether in writing, very succinctly, or in an oral discussion. And if you have the opportunity to do it orally, then do so in a way that still results with your audience being on your side, but they have a clear picture of why your option is better. And the last slide that I have here is involve the community. So the suggestion here, especially if you are doing policy briefs that are going to be received by a community of people or community groups, the suggestion is to engage them. People are far more likely to agree or accept decisions if they feel like they had an active part in making that decision. So have a soft launch of your policy brief and involve a few persons from the community and get feedback before you actually present it to the entire target audience, or involve the media. The media is a powerful tool, especially where you are having a policy brief about an issue that is relatively new, because the media will do most of the work in communicating what are the problems associated with that issue and why we need a decision to be made. And finally, advocacy groups are also very helpful and very useful. And advocacy groups are able to connect different issues across jurisdictions. So you may be able to partner with a Caribbean Youth Environment Network, for example. And there are different chapters in different islands, and that make it easier for a CARICOM policy to be created rather than individual island policies. I believe that, yes, this is my last slide, and I hope it is helpful, and I look forward to any questions that people may have at the end.
Thanks so much, Zachary. That was excellent. They've really established an excellent basis for us now to hand the mic over to Dr. Jaisingh, Lawrence Jaisingh, and him to now go in a little greater detail from a government perspective on what really makes an effective policy brief.
Okay,
so
thank you.
It's yours.
Thank you. Thank you, Madam Chair, Ms. Foster. Again, Mr. Phillips, just like you, I was a student of Ms. Foster as well too, about 10 years ago. So coming back to, thanks for the wonderful presentation as well. In terms of our linkage to policy within the government practice, I mean, you really nail the point that is really an evidence-based type scenario. So in terms of this presentation, you will see policy brief is critical because if you do not know where you are going, every road will let you nowhere. And more importantly, a goal without a policy or plan is just a wish. So a policy brief is critical in most of our jurisdictions, and as the audience is global, from a ministry government perspective, in particular the Ministry of Health, we have actually used several sources of documents to actually frame our evidence-based policy framework. Looking at our policy manual, which was originally approved and used in 2009, we have actually revised that entire policy development manual. We also use the 2021 WHO Guide for Evidence-Based Policy Decision-Making and the 2023 checklist. Now, to reiterate the third point, we have been very fortunate to be partnering with WHO Power Washington and in Switzerland. Look, and in terms of the head office, looking to see piloting with Tobago, a pilot test has been done, a checklist and assessment has been done for our policy framework itself, to assess our policy framework, to ensure it is being used, it is being validated, as we see. And this checklist was done, an assessment was done last year in June by Power WHO and a team from the London school. And they are also come back on a second round for our policy check and final report in April this year. So our evidence-based policy framework is currently being assessed and tested. And one of our critical areas from a health perspective and from a government perspective, we have looked at in terms of developing our policy agenda. It comes up from many sources, and you can start at any point. One of the first points is the WHO PAHO resolutions, and that is made on the World Health Assembly every year in April, May. And once Tobago sign on to these resolutions, it becomes policy options and policy framework for our government. Also, the CARICOM policy agenda, there are many areas in terms of the COSOT agreement and all these other frameworks that we have that we adopt within CARICOM, whether it be climate change, whether it be NCDs, etc. We also adopt our review from the commissions of inquiry. Several commissions of inquiry has been adopted in the last 2 or 3 decades dealing with the health system. In particular, the last one really was the Simongal report looking at the COVID-19 pandemic. Prior to that was really looking at the Welsh Commission on the health sector itself. So we adopt policy arms and policy options from those matters and recommendations arising from the commissions. We also look at Vision 2030, our government plan, and more importantly, our strategic plan, coming off from that Vision 2030 plan that frames the basis of our policy agenda. Two critical ones, or probably about three, came out from that really was the NCD policy and strategic plan. Also, we are looking at digital health at this point in time, and also looking at climate change. We have draft policies for all those areas that came out from Vision 2030. Our HIV national policy came out from Vision 2030 as well too. And of course, surveys, journal articles, reports, also customer and patient type staffing reports that which highlights our quality assessment, policy arms and policy options arise from those areas as well too. And in keeping with what Mr. Phillips said earlier, I just summarize it quickly. Over time, and given the methodology within evidence-based policy, evidence-based policy should be very much targeted with smart indicators, smart information, but also looking at being public focused. Why we look at output and policy issues and policy agendas all the time, it comes back to our citizens, our communities, our practice. What is the policy going to achieve in terms of outcomes? Not really output, yes, but outcomes more in terms of a policy development process. And more importantly, your policy, evidence-based policy, should be very much measurable. There should be monitoring and evaluation tools, there should be indicators, and most of our indicators are aligned to the SDG indicator itself, in particular SDG 3, that we focus on health services, but more importantly, there should be targeted, well-defined indicators from the metadata perspective, bringing it to the institutional perspective. So in other words, there's a measurable type tool and indicator that tracks the policy, and I'll elaborate more of that when we go to the policy section. And it must be obviously enforceable. The authority must be there, the governance structure must be there, and as Mr. Phillips mentioned, the resources, the funding should be there to actually make the policy enforceable. What is the point doing a policy brief, doing a policy, getting it approved, and not enforceable? Also looking at it must be evidence formed. From 2018 to now, our ministry has been using evidence-based policy information from journal articles, from reports, to inform our policy as well too, to validate the policy, and more importantly, to make the policy evidence-based, as we say. And more importantly, having some form of contingency in terms of costing and accountability to ensure that the policy really is making impact on the issue. And more importantly, is the policy really achieving the objectives that was initially approved? And more importantly, I think mentioned before with Mr. Phillips, clearly executive summary is what government looking at this point in time. I mean, in prior decades, there's be a 20-page report. Now it's really a 1 to 2 page, as mentioned before. And the policy should be brief, the executive summary should tell everything in terms of the issue, in terms of the methodology, a brief line on the methodology, and more importantly, the results and outcome, and where possible, the recommendations. So you could use the three in the circular flow, you could use the three areas there first. And if there's more information in terms of background, finance, policy implications, and conclusion, where possible, because ministers have many different areas that they looked at. And if you look at the agenda of probably a term or a year, how much policy briefs have been submitted on his or her desk? Why it is, what makes your policy brief stand out more than the other? And I'll go more into that in a little while. I'm looking to see basically what we have done to as well. Yes, with about 1 to 2 or 3 pages for the most. And what we have done in the ministry is actually tailor it to certain areas, a rubric to actually show exactly limits on the number of words, because some departments and want to write a book, but normally we want to make sure that the policy has impact, as mentioned before, has traction in terms of the significance of the area. We want to see exactly what is this policy brief, what is the issue arising with evidence, and more importantly, how is this policy aligned to Vision 2030, how it is aligned to government planning and policy and vision, how is it aligned to an issue in society or in an issue arising from WHO, from PAHOA, for instance. And as you go more into the policy examples, you will see this is just the framework side of it in alignment with what Mr. Phillips said as well too. Looking to see what areas that we could actually indicate in our policy brief. So looking at title, executive summary, recommendations, you put recommendations right up in top. But sometimes the executive summary flows into the recommendations. And if you need more information in terms of the background, the introduction, again, yes, the looking at the audience, you will have to tailor your policy brief, whether it be a technical audience, a government audience, a consumer, patient, more importantly, looking at service delivery arms in the RHA, we want to make sure that we cover their aspect as well too. And of course, looking at policy implications and looking at some form of monitoring evaluation where possible to include in the policy brief. So normally we have a rubric that is really geared to writing the policy itself in terms of evidence brief. And there are some areas that we look for in satisfying our policy brief. It must inform decision making. I mean, that's the first option. And what really stands out up to last week as well, there was a joint select on NCDs, and we were looking at some policy options of Trinidad and Tobago. Do we go with taxation on tobacco? Do we go with more taxation on sugar, drinks? And the issue arises, what type of policy options are we looking at? And we had to look at evidence-based options, looking at taxation in other countries. In Mexico, for instance, so we got a whole document put together looking to see whether or not we should consider taxation on sugar drinks, sugar beverages, and looking to see exactly, is this policy really working in other countries? And there were options. Taxation was one option. Behavioral change is one option. Legislation is another option that countries are using with respect to NCDs. So in your climate, in your condition, in your framework, what are some of the policy options you could consider in placing in your policy brief for discussion or approval? And of course, advocate for specific policies links to directly looking at the whole issue of research finance. I can looking at your policy intervention, looking at the rationale behind your policy, and more importantly, looking at your culture within your country and within the CARICOM region. Clearly, some policies that have been used in other jurisdictions might not be working here, and you want to find evidence to show. Sometimes researchers go and search and they look at this option, but this option might not be fully considered in your country. I think NCDs is one of that as well too, maybe climate change to some extent. And more importantly, as mentioned before earlier, looking to see stakeholder engagement. And this has been a major element in policy decisions. And how far and how wide and the time. Sometimes policy briefs are time driven. And therefore the stakeholder engagement might not be wide or in depth, but at the same time, looking at community members, looking at advocacy groups, experts, and of course, the persons who are impacted on the policy itself, looking at those stakeholder engagement perspective, and more importantly, looking for evidence-based brief decision-making to enhance policymakers. And I think this session is most welcome, given the poll that was done earlier, to see exactly how can policymakers enhance their style, enhance their strategy, enhance their delivery of a policy brief. I think that was done at length with Mr. Phillips. But looking more importantly, how do we convert? And I think this is the main point. We as policymakers has to see through the lens of those non-policymaker specialists, our government ministers, our other non-technical areas that need to approve the policy. But sometimes you really have to convince the persons who are approving the policy what is there in terms of this policy that will enhance society welfare, that will enhance and fulfill national objectives. And more importantly, better the country ability to adapt to any circumstance. And this is where education of the policymakers are critical. It's not only looking at your silo, but how do you look at it from different lens, from different angles. And the last point is critical as well. How do we then evaluate our existing policies? How do we look at evidence to say exactly, is the policy working? Do we need adjustments? Do we need improvements? The point is, you might have an initial policy brief approved. And one of the critical areas that I could use an example here, is our national breastfeeding policy that was done in 2019. And this policy actually looked at different areas from WHO, PAHO, from CARICOM policies as well too. But more importantly, as the as the breastfeeding methodology and practice evolve within NCDs, our policy briefs are subject to change. And sometimes we need to look at see exactly how can we, with the adjustments and improvements over time, show critically how our evidence brief can be adjusted to reform and we adjust our policy to the circumstance within society itself. So from our policy development process, we have adjusted our entire policy development process to executive summary, introduction, a situation analysis, local and international. But more importantly, number 4, looking at the policy goal, purpose, characteristics, scope, services, delivery method, and more importantly, looking to see how this is aligned to your own jurisdiction, how it is aligned to your own circumstance. And I'll go through some examples just now. You'll see exactly where we have used this entire framework. Again, looking at governance and leadership is critical because sometimes we look at policy documents and there's no ownership. In terms of implementation, there needs to be some structure for implementation. Again, aligned to, as mentioned earlier, resources, whether it be financial resources, human resources, information technology, and in looking at the connectivity part of it as well in terms of information generation to show exactly your policy implication and policy assessment. So therefore, when you're implementing a policy, yes, you look at all the different arms, but we realize as well, qualities from the healthcare perspective is a critical component in managing our society and managing our healthcare delivery system. And of course, for impact assessment and continuous monitoring and evaluation for your policy process as well too. Some examples, and this is what I really want to go through in terms of using that background there, where these policies came out from. And a couple of them, and I'll show you a policy brief. On the last slide, you'll see a policy brief. I'll show you the next document. But one of the most critical areas came out from number 2, non-national policy. We actually use this similar framework here. I'll go back the framework again to look at exactly where we use the non-national policy. Now, this non-national policy came out from cabinet. There's a cabinet minute that came out indicating that the Ministry of Health, by X date, had a timeline as well too, to develop a non-national policy. Now, in Trinidad and Tobago, we had an open field, you could say, the persons on a given day will come from Caribbean Islands, whatever area, and access our healthcare services. And one of the first option in doing a policy brief was to indicate the magnitude of the service, how far and wide our service is. And when we did that, we went to each IHA, collected information on non-nationals accessing our services. So the policy brief had one paragraph looking at the quantum of services, the number of persons, and believe it or not, persons from Afghanistan, persons from Asian continent, African continent, North American continent, access our services, and they were wide across the service itself. And the policy option came out from basically consultations done to see, first of all, when we looked at our legislation, what it is in our legislation that we have, is mandatory that we actually look and see exactly what services we must offer. So from the policy consultations, the legislative framework that we had looked at as well too, and our CARICOM obligations, we actually craft the policy based on those options. And what came out of that was basically looking at accident emergency, primary, secondary, looking at vaccination, immunization, and looking at maternal and child health, where we are obligated to actually, once we are born in Trinidad and Tobago, that the reality is you have to see about the, of course, in any other country as well too, where you have they have become national. So we look at the obligations from our side to crafting the policy options. Now, this is where policy options can be viewed from a technical perspective and from a society perspective as well, and the use of resources. So those were some options. When we look at this slide, here looking at policy options in the first point, that is where we came up from different policy options and crafting that policy. Another one that could use an example is looking at our the mental health policy. Our mental health policy was wide as well, but then we looked at the frameworks from WHO. We might mention WHO, I'll go back to that slide. WHO, CARICOM, to see exactly what are some services that being offered, what are some gaps in the process. And the core aim of the mental health policy was basically to decentralize mental health from a community perspective. And that came out from different resolutions from WHO PAHO. That came out also from different commission of inquiry in terms of satisfying the requirements under the then acts as well too. So that came out, policy options came out from those aspects, looking to see how could craft your policy in terms of mental health approach. One of the policies that we are doing now is going to the, well, actually, no, we did an impact assessment of the various policies implemented. And in the maternal health policy, we looked at, we already achieved our SDG goal in 2018, 70% 100,000 live births, less than 70% of 100 live births. We have attained our breastfeeding rate from 10% to 85%. Our NCD plan and policy, we have control hearts, treating hearts initiative, control our hypertension rate for a certain sector of the population who's been treated from 37% to 48%. And of course, our mental health policy, looking at decentralizing our plan to all institutions, society, and more importantly, taking a community type based approach. So we have done some form of policy assessment in checking our policies. And also, from our perspective, we have looked at updating our manual. We have looked at having training capacity building done. What you have done in the ministry is really bring the policy and research together, arms together from different departments to see exactly how can we lend support and training in developing policy brief and developing our policies. One of the policies I'll pick here to institute our policy framework, evidence-based framework, is our digital health policy. Now, in doing that brief for digital health, there was competing resources. And sometimes you have to look at the structure and the climate and where could you fit this policy agenda. Now, but post-COVID, and most institutions actually doing digital transformation and using digital platforms. While this policy objective came out in the 2020 government policy framework, the roadmap to recovery, we drafted the policy then, and digital health was not the name of the policy. At that time, it was e-health. And what we realized post-COVID, when we did the research again from WHO PAHO, again from different countries, the term digital health became the norm. So e-health really evolved from health information system to e-health to digital health. And by, you could do all the policy options, you could do all the policy briefs, but the context of your policy and the condition in which your policy is at this point in time, the need for the government had a need at this point in time, post-COVID, to digitalize the entire environment. And this is where the digital health policy brief came in so critical. And one of the major challenges that we had, and most countries actually experience this, is funding. And when we look at the policy brief, while the initial one had the whole health information system with digital health platform, we sought to actually tailor it to the certain needs within the ministry and within the population, and more importantly, within using a commission of inquiries and that revolve in terms of where could you digitalize health. So we looked at 4 options in the policy brief only, looking at e-prescription, looking at vaccination, looking at the whole issue of NCDs to a national registry, and more importantly, looking at our national lab system. So those came out as key areas of digitalization, while we pinned the entire digital health framework, map it against different countries as well, but tailor it against suit your perspective, your area of need, so the policy brief could be approved, right? So sometimes ministers of government, when they see certain documents and they see policy areas, they might say, this term look good. When they see digital health, it looked like a catching term. But more importantly, when you read the first paragraph or the second paragraph, it came down to what area of need that you're looking for. And that's how we got our digital health evidence brief approved. Also looking at our climate change. Now, this came out from a workshop that PAHO did.
So, Lawrence, I'm really sorry, but we are really pressed for time. So your time is, we're way over time here because we still want to allow for a little bit of time for questions.
Sure. I just want to stop sharing then and present
Yeah. So what I will ask is you just pause for now. We can maybe pick up some of those in the question and answer
I
session.
know. I just want 2 minutes to present one thing to show exactly an example of a policy brief. I think we're talking policy brief, but it's no example. Just for 1 minute, right? So in July 2018, we did a policy brief on taxation. I know the main thing was this, as Mr. Philip mentioned, words is one thing, but having a catch eye in terms of the title, having a catch eye in terms of noticing the problem, the approach and the process, this is what lend itself for our policy brief to be approved. So it's not about the information is there, but also looking at the information, how is it presented, is very critical in terms of getting your policy brief approved. And this is where I wanted to have discussion on this, but at time is running out. But at the same time, one point I want to make before we go is looking at the evidence. We got, because of NCDs, we did an economic cost of smoking, which came up to $1.8 million, a burden on the budget. And that is what lends itself to part of it, again from the service done on the right-hand side, getting our policy brief approved. So it's looking at the whole issue, how you present the information, how you present it is critical in terms of a successful policy brief. Thanks again for the opportunity and thanks again for your time. And I'll welcome any questions thereafter. Thanks again.
Okay, thanks so much, and that's really excellent, and a number of comments really welcoming the concrete example. So in the interest of time, I'm just going to hand over very quickly to Dr. Dawkins-Wright. We're at 1:07, so you have 16 minutes, and then that will give us 15 minutes to interact with our audience. So over to you.
Thank you, Ms. Foster, Madam Chair. And let me just take, I know we strapped the time, but I have to say a very special thank you to the organizations for allowing me to participate in this process, especially because it's such a very, very important, urgent, and salient issue that affects all of us. And so this is really a great opportunity to say thank you. And I also want to commend and congratulate the participants for joining on, because it sends a message clearly that this is something that really needs to happen. And I commend you and share in that. So where I'm going to take off from, and I hope I won't speed a little bit too much, but a lot of the information has been captured by my two co-presenters. And so I am trying to frame my presentation to support what has been shared through a case study on the Jamaica's Climate Change Policy Framework for Jamaica, which is a policy paper that was based on an effective policy brief that was developed, and to show some key consideration that goes into the process to try and ground the dialogue. Now, we would have had, I am here trying to advance this slide. I'm not sure what's happening. Okay. That we would have had a poll section that asked you to consider. I want you to take just a second again, just whilst there are several different roles that you may play, regardless of your existing position, just take a second and probably just consider what I presented on the slide and see where you fit. Generally speaking, as Counsel had said earlier, most of us participate in the policy process in some way, shape, or form, even though we may not actually say it. And on that basis, I'm asking you to look where you are now and where best you see yourself, because it helps you to assimilate the information that we have sharing today. And so a good place to start, again, is just to remind us as to what a policy is, and therefore what the policy brief needs to do. A policy will speak to the initiative, decisions, actions that help to address certain pressing issues within a society, and it represents the purposive course of action to deal with a problem or concern. And this is a problem that produces either a human need, deprivation, and or dissatisfaction for which relief is required, in general, as a place to start. And in the context of policy, which is the business of government, government must therefore perceive that the problem exists. So therefore, we participate in the process, and in some way, shape, or form, there are many, many policies that are bound, and some key terms that I think is important to consider at this point, so we understand the information shared today, is that the vast number of policies generally are informal policies, which are usually unwritten norms, practices that influence our actions. And I want to emphasize that not doing something is actually a policy position that a brief will advise on in general, to say it's not absolutely necessary to act at this time for a variety of reasons. And those variety of reasons are the little nuances that I'm hoping you will pick out by the time I end this presentation, that informs the policy process. Because as presented thus far, it may want to appear that whilst sounds very, very simple, the truth is the policy-making process can be a very cumbersome and complex process, and we won't want to take away from that, because that would be misleading. Importantly to consider is that what I think we recognize here, we are having a conversation about climate change and health because we recognize that effective policy is one of the most effective ways to advance as to address the increased risk of health in the area of climate change. And so formal policy is what I really think we are more interested in, is what's referred to as the big Ps. Now, these are official documents which are legally binding and are structured and form a codified aspect of government decision-making process, and therefore may encompass the laws and regulations and inform how resources are allocated. And it's very, very important for us to appreciate that that is probably where we want to anchor our conversation. But what I want to remind you of is that whilst there may be several problems, most persons can identify a problem. Generally speaking, where the challenge happens is the characterization and definition of a problem, which is critical to framing the policy document, the policy brief, and the solutions and options. And generally speaking, by the time a government comes into play, an organization, whether it be public in terms of our state entities and government bodies, there may be organizations, but the governance around that organization would have already considered some key issues that inform a policy agenda, which is the collection of issues that hold significance for government or society during a specified period. And what I want to emphasize is that generally speaking, a problem may be significant and very, very important, but there may already have been an agenda that has already been played out and presented and agreed upon in terms of the next phase to happen. And whatever issues we are bringing to the table in terms of proposal is most likely to be advanced if we can align that policy position that we are recommending against that policy agenda. So it behoves us, no matter what we play, to understand what is the policy agenda so that we can craft our policy and our policy brief to support that policy, even within the existing policy agenda, in order to gain progress on that. Now, where we are talking about and we are landing our conversation is on public policy in the context of climate and health, which is the matters to address societal issues. And because we know that in the context of public health policy has probably made the most profound impact on where we are in terms of health status, and has been probably the most significant contribution to why we have been able to advance to where we are in health status indicators in the 20th century. But it's important that wherever we are, public policy, one of the most difficult kind of public policy to advance, it has to be grounded in its technically sound information, which sometimes may be limited and not comprehensive enough. It also has to put on the political flair to it and be administratively feasible, or again, as Counsel would have stated, it will land on a desk and not move if administratively what we are proposing is not feasible given the current existence. Now, the case study that I'm alluding to is the Climate Change Policy Framework document for Jamaica, which is actually not a policy brief, but it's a policy document that has been very impactful in our discourses because it has been referred to in many of the climate discourses and publications that we have. I direct you to, for example, the CESAR project that produced the country profiles on climate and health for a number of countries, including those, and it is this policy document, this policy paper that has been referred to as a significant achievement for Jamaica, both in what we are now at the third iteration of this document as grounding. And it was based on the fact that the policy brief in and of itself was successful enough to advance the process. Multiple policy briefs inform this policy document, and as pointed out earlier, generally speaking, the briefs are short, but the policy document is usually much more weighted, and we have to appreciate what is the purpose and what exactly we're talking about, because it's one of many different tools that are utilized to advance the actions. Now, we're saying that today is an introduction because, as we recognize, this is a profession, it's a discipline, and there's a body of knowledge around the issue of policy making and policy positions and being able to prepare policy as a policy practitioner. And there's science surrounding what makes an effective public policy and makes it effective in terms of implementation. And in general, the vast majority, regardless of the study, will kind of show you the evidence that in the context of public health policy, it's aligned a lot more to primary care processes and recommendation, and unfortunately, the fact still remains that there's still not sufficient enough value being ascribed to primary care and prevention to allow the galvanization and coalition to support advance implement the policy. It is a reality that we have to bear in mind when we are considering whether or not we want to participate in the policy process, because we're going to have to take that on as a challenge. And because of the nature of primary care and public health, not uncommonly, there may not be sufficient evidence to support some aspects of the solutions that we need to clear. And as pointed out earlier, the decision makers in terms of who advancing the policies are not the specialists in their area. And if we can't provide sufficient ear to answer all the questions, then sometimes, as important as there is the need for that policy, it goes no further because we haven't answered all the questions that need to be answered to gain the approval. Generally speaking, researchers tend to be isolated from the policy process, and this is a bridging opportunity, and this is something that has been recognized. It is improving, but we still have some more to go. And because it is a political process, not uncommonly, the science and the practitioners, for example, in climate and health, may not necessarily line up with what is going on the policy agenda, which, as I said, would have oftentimes been crafted already, and what we are presented in terms of where the resources go is not exactly aligned to that, and so that presents a challenge to where we need to go. Importantly, however, and something I've learned in my practice in general and consolidated in the context of public health, it is often better to go for incremental approaches rather than go all or nothing principle, which moves the dial along. No public policy position is going to move any further in terms of what we present in that brief if we don't consider the cost, as Counsel would have identified earlier, and what it is going to take to enforce that policy recommendation and bring compliance into implementations. Generally speaking, no one policy involves any one discipline, so people have to work together. Working together is not the easiest. Convincing several different persons, different perspectives, different backgrounds is not easy, but we have to do it and we have to understand it because the skill of diplomacy comes into play. Again, that's not in the hard science of the body and of knowledge around policymaking, but as a policy participant are playing on, those are the nuances that we're going to have to build on, which comes through experience. A lot of the times our experience is not hard because we are scientists generally, and it's not that easy to communicate the solution. And so in the context of communication, we have to factor how do we deliver that message. But by far, one of the most significant barrier to successfully implementing effective public health policy is that we are not properly framing the policy so that it incites and persuades the persons who must advance that policy position. It must translate the knowledge as pointed out in succinctly and understandably so that the concept and elements that we are presentable is understood by persons who are pretty average in terms of what they understand. Learned, informed, but not specialists in the area that we are providing a recommendation. So in the Jamaican context, we recognize that this is a challenge. it is the business of government to do policy, and therefore it behoves the government to ensure that we are in a better position to do so. And so as far back as possible, advice has been done in the modernization of the public sector for Jamaica to provide a standard process that is tailored to our existing context, that factors our cultural considerations or institutional arrangements, and allowed for that process as far back as 2005. And it was recognized that a reference document is important, which is readily accessible online, the guidelines for the development of national policy in our context, specifically to address that significant problem of the improper framing. In the context of our seeing, the policy formulation in this process that has been presented for Jamaica has been defined about 10 different steps. Now, 10 different steps means 10 different kinds of way to prepare your policy brief. Same point, same information, but depending on where you are in the policy formulation process, that policy brief must be tailored to that target audience Counsel would have identified earlier. It must put the narrative in such a way that it advances from a concept note through the process to reach the cabinet for review and approval, being tabled, engaging the different arms of the public through consultation so that we can get to the point where Parliament approves that policy position and it becomes a national policy, which is that course of action that we are taking to resolve a specific problem, an official document. Identified just before is that there are antecedent processes of which the policy brief would need to speak to. It is important to recognize what is the effect you are trying to achieve in that policy brief. And they have a different purpose depending on where you are and which process we are undertaking. Assessing the need is usually not difficult. That's the science. Under the standard problem is not usually the difficult part, despite what it is, because we can generate the science. Where the challenge comes in usually is the stakeholder engagement and how we plan for that stakeholder engagement. And unfortunately, that is the most time-consuming part that requires a lot more work and a lot more skill set, that requires actually more experience, that we have to exercise those soft features to advance the policy position. The policy brief must recognize that it is a type of policy paper. Generally speaking, that brief is not a standalone document. There is usually another document, the policy study, for example. An analyst would have sat down and looked at, prepared that policy analytic report that goes along with the policy brief. So generally speaking, it's not the only policy document on that specific issue. But importantly, it is a communication tool. And in the process of communication, there's the message, there's the messenger, and then there's the recipient of the message. And if we don't consider this, then our policy brief will not advance, because who is delivering that message is going to be important. Sometimes the person who presents the problem is probably not the best person to deliver the message if we want to move it forward. And as mentioned, for example, if we go to indigenous communities, we may have to frame our conversation in such a way, same facts, such a way that it connects with the people, because it's a communication tool. And generally speaking, the brief is about advocacy, which is the hard part. Most persons who participate in the process are not usually the writers of the policy, but they are important. And so we have to oftentimes make a number of briefs, such as what would happen in our Jamaica's climate change policy framework, and separate the processes of writing versus advocacy. Our target audience, I won't have to go any further,
1 minute
but 1 minute, sure.
1 minute.
That the document in and of itself is an action-oriented document. It's not an academic document. Counsel would have identified that title is important in it, because sometimes it's that elevator speech. Sometimes the title may be what sells, makes or breaks that point, and that executive summary, which may be the only part in that brief that is actually read, and therefore the options are high level and strategic, and we have to advance it. In the context of the climate change policy framework for Jamaica, it was in fact the time that I mentioned earlier is important, and within the Caribbean, it was in fact one of the things that happened, because several projects were in play at the time for Jamaica. A lot of policies and the stars aligned to allow for this for the processes to undertake to advance the coalition and the condensation of the different policy briefs that inform that policy document, chief of which was the fact that it occurred round about the time when we were producing our national development plan, and it facilitated the different time nodes in terms of enshrining the aspect of that policy brief, policy paper, because it speaks to the issue of climate change and health. It did help, of course, that within including our nationals, our own Professor Taylor, who is a climate studies group of Mona, was a key part in the IPCC process in the 1.5 report. And so again, it lends itself to opportunity and timing that favor the advancement of the project, of the policy position. And we identify that despite the period that has spanned over the period since it was first approved and finalized in 2015 to where we are now, the issues remain consistent and current, and it will tailor in and allow for the facilitation of different sectors and disciplines, including health, and our 10-year strategic plan to support that national development plan clearly enunciates the areas around climate change that supports it. Importantly, and favorable to the climate change and health discourse, is the matter that we have this robust epidemiological program for surveillance to provide equivalent amount of historical data on health status that can be aligned to and collaborate with the data that supports the climate evidence, that we can now transition our health program to being climate resilient through the incorporation of climate informed data in terms of, for example, our surveillance program. So we know where they are, and it has set the stage. The timing is important. So within the last year, that set of factual information has informed a lot of things, including the summary for policymakers, and set the stage for the data, so that last year we could go a little further with another policy brief that allowed us to have the stakeholder consultation for the development of Jamaica's HNAP, framed within the context of that climate change policy framework document that was produced however long ago. And we are now far moving along with the supporting elements in terms of what PAHO does to build capacity again within health under the smart healthcare products. We are now looking in terms of the more urgent issue of heat health, again, enshrined and on the platform of that climate policy framework document, so that we were in a good position to land a commitment at the first health platform at the conference of the parties, where we committed to, again, incorporating the evidence existing for Jamaica and health within that very same climate change policy framework, to make that commitment to developing a climate resilient system and capacity. And this final side, Madam Chair, is just to emphasize that the policy brief in the context, which has been alluded to and which was elaborated and demonstrated through the several policy briefs that preceded and has now followed Jamaica's climate change policy framework document for Jamaica, that policy implementation focuses on converting those policies to outcomes and results, and requires that the policy lead entity, in this case the Ministry of Health and Wellness, knows what it needs to do, has the ability to marshal and control the resources for the results that we're talking about. And so we position ourselves to communicate, recognizing that this is a communication tool. But before we consider that brief, we must recognize if there's not the institutional capacity, we are going to be at a standstill again. Stakeholder is critical, and we have to manage and use modern technology, including information technology, to galvanize and get coalition around the salient part of advancing a policy brief. That I hope will allow for us an example for Jamaica's climate change. That's my last slide, Ms. Foster, and we can elaborate with some questions and answers. I think I did fairly well with time, correct?
Thank you very much, Dr. Dawkins-Wright. And we're going to jump right in. We have 10 minutes remaining. We have a few questions that were collected. The first one, so we have a few that are directed towards Zachary, and a few that are directed towards Lawrence. So let me start with Zachary. And the question is, they're speaking to the fact that you've spoken about, you know, a lot of the time, the audience includes policymakers, they're saying, but a lot of the policies that are being addressed are targeted to issues of a minority or vulnerable population. And the person is wondering, how do you convince policymakers, who tend to be the main audience of these policies, that it's even worth their attention or resources? And what has been your experience in terms of getting positive buy-in by policymakers on these issues? So where we have these issues, which are really very focused on a small community, maybe a minority or vulnerable group, how do you get that buy-in? How do you convince the policymakers, or what in your experience has been useful in terms of getting movement forward on policies in those areas?
Thank you.
Zachary?
And I think that's a great point to make. As an advisor to the government, I would say that in my experience, as Dr. Dawkins-Wright has indicated, when the stars align, you must take action. So if it is a situation where there are vulnerable communities or vulnerable groups who are affected, usually if I know that the media houses or the public sway is not on the side of supporting these vulnerable groups, then I may not necessarily make the pitch or make the suggested brief to the policymakers at that point in time. But as soon as there is something that's happening within the media space or something that's even tangentially related, then when it is time for me to make the pitch, if I could use that word, I try and tie in other relevant factors that I know that the policymakers would be thinking about. Hint, hint, usually finance is a great way to get policymakers to do something or not do something. Then that's what I try and focus on or tie into when I'm making the pitch. I hope that's helpful.
Okay, thanks so much, Zachary. And I'm going to jump straight to you, Lawrence.
Mhm.
There's a question asking, is there something specific or could you recommend something that should be included in policy papers related to youth health that would make them readable for stakeholders? So
I-
youth health,
mhm.
policies
Yeah.
for youth health, what elements would make them readable?
I think is really visibility, as Mr. Phillips indicated earlier. Looking to see how we present the information quick, fast, because they have a small little window of 30 seconds, just like a TikTok video. That is how the element of research. How do you translate all this information to visibility to make it in the not only to the eyes of the youth, but take an interest in the subject matter itself? I think visibility from NCD's perspective, I could say that very clear that a long video of 2 minutes is irrelevant and it's too long. And we have tried to make it a 30-second video and also publish certain key ads, take-home ads that ticket their little brain to see exactly this is my focus, but also lastly, to make it focus on their agenda as much as possible. Because NCDs is a critical component for the youth, and we want to make sure that it is actively participated in their own environment, in their own space, and at their own time, which is critical.
Okay, thank you. Let me scroll down quickly, see if we have any extra ones. Then there was another question, Zachary, to you. Should the call to action to various stakeholders, for example, government and national regulatory bodies, health institutions, etc., be part of the policy statement?
I think that a call to action should be part of the policy statement, yes. Again, it's always how you use the information. I think both of the speakers made very clear and useful examples of the fact that a policy brief is a part of a tool package. So while the call to action would be useful, how do you engage with your audience and how do you use that call to action to actually get the policy brief adopted or the overall policy adopted is up to you and based on your interaction with who you're speaking to, but definitely included, yes.
Okay, and we have a question to all the panelists here, but I'm going to let Nicole start in the interest of equity. So the question is, will the US presidency, we couldn't get away from the question to do with US politics, right? Will the US presidency have any impact? I think really what impact, because it clearly will have an impact on climate policies related to our country. So I'll start with you, Nicole. And maybe so let
I'm
me
gonna
add
think
a
that
little
you're
spin
being
on that.
unfair.
Let me add a little spin on that so you can have it percolating. I'll add a little extra spin and how might we adjust our current is there any space for adjustment in our current policies to take account of how now the landscape may change post this new presidency? So the floor is open. Nicole, if you don't
Yeah.
want to go first,
No,
that's
well,
fine. If
I could,
whoever
I could
wants
go
to jump
first.
in first can.
I could go first. Yes, this is a very excellent question and a real question because even today in work we actually discussed this part of it being in health. The US actually decided to withdraw from WHO PAHO,
Yes.
and that is not only a policy implication but worldwide implication in terms of treatment management of diseases. Non traditional diseases or NCDs. But the issue really have become is really more of self-control and self-management. And more importantly, how do we use the resources now? But sometimes all the resources we had, we tailor for different options, but now we have to condition it more and make it more impactful in terms of achievement what we want. For instance, if we want to achieve climate change, we look at climate change at length, and we know the presidency in terms of his own view on climate change. And how do you then tailor your policies now? Adjust your policies, but at the same time, maintain your local essence of the policy. Okay, want to make sure that they satisfy your need. I mean, that is all the presenters, and thanks for the wonderful presentations too, have indicated your policy has to be based on your need as much as possible, because your resources you're going to use for your own policy option. And I think that is more critical in terms of I won't say any follow-up, but the adjustment that they have to make in terms of the global change within the environment as well too.
Absolutely. Okay. Who's up next, Zachary or Nicole?
I think Zachary probably is in a better position to anchor the conversation, because I have one little point I want to say. I'm a clinician at heart, and whilst I work at the ministry, you know, my point is I do believe it certainly will influence probably how we progress. But I think on a global level, I think a lot of coalition has been established to the point where we recognize that progress can be made. There's still a lot of influential organizations, entities, and states that are aligned to where we believe the action needs to take. And whilst it may impact how we progress, we should still hold fast and align ourselves and position ourselves, participate in the process, because we all have a part to play. We may have to adjust, but I think we can still move forward despite the position that may have been taken.
Okay, thank you. Now, Zachary, you're going to have the last word. Counsel, so Zachary was counsel in the for Antigua and Barbuda, one of the counsels for Antigua and Barbuda in the advisory opinion request to the ICJ. So I think it's maybe most appropriate that we end up with your views on this question.
Okay, well, no pressure. I would say a synopsis of what has already been said is that I also agree with 1 from 10 will not leave naught. I do think that the US leaving from the climate change treaties, from the World Health Treaty as well, it will have an effect, as both of the speakers have said, but I don't think it necessarily has to stymie progress. What I really, really hope for is that our leaders are not persuaded to backtrack on any of the decisions that have been made going forward. And I do think that is where most of our focus has to be now when we are drafting policy briefs, because there is a great temptation to just side with the new president, knowing where his alignment is, knowing where the economy of the US may align for the next 4 years as well. So I think it really becomes the onus on us to stick with where we are and what we know is best for our outcome, what are our needs, and what our audience needs to see when we are creating policies.
I think that's a wonderful note on which to end. Realistic, pragmatic, but still optimistic. And I hope that, you know, the message goes out and it resonates with the powers that be. At this stage, I'm just going to hand back over to Daniele. I think she wants to share the slides for the upcoming session. And just to remind persons as well that the link for your continuing medical education credit is in the chat. So you should click on it within the next 24 hours so you can get that sorted out. And please, we encourage you to join us. There's been wonderful engagement on today's session. I mean, we clearly needed more time. All the presentations were excellent, and really there was much food for thought and much more detail that could have been gone into. And so we're really hoping that we can build from this session and have, you know, maybe something, a little follow-up and a little bit more concrete and practical. But thank you so much for your engagement, for your participation, and we look forward to seeing you in the next session, which will be on how to gather and share data for effective climate action in health. So with that, I bid you adieu. Have a safe night, and let's continue the fight for climate justice and for our planet.